The appointment in 2013 of Simon Stevens, a former CEO of America's largest private health insurance corporation, United Health, seemed to campaigners another key step in the marketisation of the NHS. Given how notorious the American health system had become for its exploitation of people's health needs, I had found it difficult to believe that the NHS was in danger of being Americanised. But a young doctor's disturbing revelations helped make me think again.
I'm the one that on the wards, I have to tell the NHS patients they have to wait a few more days for their scan, a few more days for their chemotherapy, people with cancer, and yet the private patients go directly up. They're getting their treatment immediately. So I am seeing in real time right now today the emergence of that two-tier system, and what the emergence of that means is that you start blocking care, you start blocking access to the NHS patients, you start blocking it to people that can't afford it.
To campaigners, NHS England's plans, with their demands for further cutting of services and hospital beds, were central to a strategy of deliberately creating shortages so that the public would turn to the private sector to provide them. What the public were not being told was how the Americanisation of the NHS was already being embedded with NHS England's implementation of integrated care systems. Nor were they being made aware of the involvement of big American companies like US business consultants McKinsey, United Health's UK subsidiary Optum, US healthcare giant Centene, and other US interests in the planning, running and provision of a now commercialised NHS.
The companies that now in the UK, like Hospital Corporation of America, are being done for fraud and embezzlement and treating patients for heart surgery that they didn't actually need. It's the American companies and the American health insurers that have been putting pressure to remodel the NHS along US lines.
United Health Group has a long history of documented abuses, including violating antitrust laws, denying claims for medically necessary care, squeezing independent pharmacies and physician practices out of business, and manipulating data to maximise its profits.